Everybody used to have to ring into a call centre and they'd have to wait for someone to answer their calls, and we'd send letters out to patients, and it was all very dependent on the post. And now we have a much more efficient system whereby over 70% of our patients are paperless. So they're receiving their information about their hospital appointments through their personal device or their laptop through the MyCare patient portal. Milton Keynes offers integrated appointments in all our outpatient services. That is approximately 35% of all our appointments, which equates to about 80,000 appointments a year. So we've done some research, and we know that patients that are part of our MyCare patient portal have a DNA rate that is approximately half the normal DNA rate for other patients who aren't part of the MyCare portal. How this has helped our patients at Milton Keynes is that they don't arrive in the wrong locations for their appointments, but it also means that our staff don't spend hours on the phone trying to get hold of patients before their appointment, especially for any emergency bulk messaging that we send, which has saved an awful lot of time for our staff using bulk messaging. To give you an example of how successful this has been, we are sending text messages to, well, about 10,000 patients since January. And of those patients, we've actually removed 8% of those patients who no longer require their appointment. It's an easy way. It's not involved letters or telephone calls or anything like that. It's just been purely done via a text message. That's been incredibly successful. We also use Form Builder for our friends and family test. Prior to using Form Builder, our results were quite poor, and we maybe had handfuls of patients coming back to us telling us what our services were. Now we use Form Builder. We're sending the Form Builder questionnaire for friends and family to thousands of patients a day, every single outpatient that we have, inpatients, A&E attendants, and we are getting quite a good response rate. And now we have thousands of patients' information coming back to us to help us, A, let us know how we're doing, and B, help us to improve our services. It's been a stunning success. We've also used Form Builder very recently to validate our PIFU list for rheumatology. PIFU stands for Patient Initiated Follow-up List, and we had some patients that had been on that list that we hadn't heard from for a while. So we sent them a questionnaire about whether they still wanted to be on the list. If they did, what was their condition? When did they think they really ought to have an appointment? And from that, we managed to remove 25% of the patients who no longer said they needed an appointment. So again, that's been incredibly successful, all for just sending a text message. One of the ones that's really quite interesting is the admitted patients, because if you think they're inpatients, and we had about a 5% removal rate. And if you think how expensive that is, those are inpatients, because you've got day cases, etc. And 5% of those patients have gone somewhere else and they want the appointment anymore. It's amazing. results have been very encouraging. We've had excellent feedback from patients and also consultants. So some of the feedback from patients has been they really like using the system. It's very easy. They've not had to wait while they're having to input information. It's all there for them. The vision has been really good. The sound quality has been excellent. But what they really appreciate more than anything else is the fact they don't have to come to the hospital. They don't have to get car parked. They don't have to get in to look after their kids. Someone's come back to us and said it was great. I did the video in a room off my staff canteen. You know, they're able to fit it in around their lives rather than the other way around, which has been excellent. And then consultants have come back to say they're really happy with the quality of the video. They've also said that they really think have been able to get so much more from the appointment than just a telephone consultation, and they found it really easy to use. So far so good. Everything has worked really well. So we often do workshops in the main entrance of the hospital, and these are designed for patients who may be having some issues getting onto the portal, and also staff who maybe aren't on the portal themselves because they're not patients, but we want to be able to show them what the portal looks like so that when they have their patients come to them with queries or questions, they can answer those queries and questions. This has been incredibly successful. Working with induction, we've now been able to link in with the NHS app, which has increased our coverage immensely. To me, the patient portal is around giving patients access to their healthcare. And to me, that's the most important thing.